Hello, everyone. My name is Andrea Castro. I'm a student at UC Berkeley, and I'm also a COP Coalition member. I work closely on CYAN with their college initiatives. Before joining COPT, I served on the CYAN board with Kim. I love Kim. On the youth board of directors for a couple of years. Earlier this morning, we heard from Kim and Dr. Nguyen about what student tobacco use looks like today and the different challenges that colleges face when it comes to addressing tobacco use. We want to discuss different ways that colleges are addressing tobacco use on their campus. It's important to note that colleges have different funding levels and staff capacity when it comes to addressing tobacco use. So we want to make sure to take time and showcase and celebrate the work that is being done on the ground. For our panelists, we have Jennifer Taylor from UC Santa Barbara, Natalie Townsend from the University of San Francisco, and Amy Uribarn from Modesto Junior College. I will give each speaker about 10 to 15 minutes to talk about the work that is being done on their college campuses. After that, we will allow time for questions at the end. Jennifer, Natalie, Amy, is there anyone that wants to go first? Nope.
I don't mind going first.
Perfect, thank you.
I'm going to share my screen. Is that coming up for you?
Yes, thank you.
Okay, thank you. Again, my name is Amy Iribarren. I'm Director of Health Services at Modesto Junior College. My pronouns are she, her, and hers. And I will just give you a little bit of background around the efforts that led us to become a tobacco and smoke-free campus. We just implemented that policy in January of this year. So I don't know how many of my colleagues are on this webinar from health services, but if you recall back in 2021, January, this is when we relaunched the effort to become a tobacco and smoke-free campus. And at that time, I was just, inundated with COVID. And this kind of represents how I felt at the time. I just didn't feel like I could really take on anything else. I was probably very irritable and just didn't know how I could fit this new sort of effort in. I knew it was important, but I quickly sort of tried to figure out like how to incorporate my team in this work. So again, we started kind of relaunching the effort in 2021 of January. It was really through the efforts of Delana and Chelsea King from the California Health Collaborative, as well as Katie Moose. They really started the conversations. And then through them, we just helped pull in a lot of key stakeholders. Of course, students, student government, our allied health faculty, community health providers were very helpful. Then we had an interim president at the time who was very dedicated and willing to see this through before he ended his term. So that the timing just was really key to help us move forward, because we have tried this in the past and it was pretty difficult, and it just, the timing was right. We also really thought about some anticipated kind of resistance and what we would possibly be seeing on campus to move this policy through. So I will say those folks from California Health Collaborative and CYAN, you all were so helpful in helping us develop talking points and really thinking through like what would some of the barriers be, and and think about how we would address those. So your work in helping us get there was really paramount. And again, we became a smoke-free, tobacco-free campus in January. So we had an F grade before, and we're finally there. We were very late, but we are a Central Valley community college, and a lot of our neighbors were late as well. So we're just happy that we're here. We are a campus of about 16,000 students, and as many of you know, working in the community college system, we have a small but powerful little health services that tries to serve a large number of students with multiple needs. And oftentimes we have to evaluate our capacity and being able to see through some of this work. So there's a lot of collaboration that goes on. But I will say some of the challenges we experienced was just a little bit of early resistance. We had to kind of think through what the board was looking at, some of our union folks, like how we can get those talking points together. We have a district that includes Columbia College, and they have very different needs. And we were able to, as a campus, separate the two colleges to create our own policies for developing this tobacco-free campus policy. So, they're very rural. They were very nervous about having smoking move from a designated area out to, the brush and the forest, and they have real increased risk for fires. I mentioned capacity. That's just always a challenge in our work. If we're going to launch this effort and be helpful to students, how do we incorporate better tools and services to address, some of the needs around tobacco use on campus? And then I found that, I really wanted to try to find a way to implement NRTs in our work, so nicotine replacement therapy, and just found that through some of the research, it's just very difficult to dose and implement. It's costly. So we kind of had to eliminate some of that early on. The dosing is difficult because of the large amount of vaping and the inability to identify how much intake is occurring to be able to dose properly. So still considering how to do that in the future, but for us in our setting, it's difficult. A lot of wins. We're really working on prevention efforts now. We started this work last year. So it really kind of leveraged like this opportunity to learn more from the health services team. So we have 4 nurses, one mental health provider, and an intern team of MSW interns. So how can we learn more about what the current trends are? A lot of what was discussed this morning that Kim brought up. So we needed to sort of evolve and learn what the behaviors were from our students so we could then tailor our outreach and services appropriately. So as we started to learn, we started to really reimagine our services, be more intentional there. And then just like health services became more of a name on campus. People, students, faculty, staff just got to know us a little bit more because we were so collaborative in this effort to get the policy passed that those who didn't know about us before, I think, started to learn about us. And what we found over some studies in the past couple of years is about 26% of our students don't even know we exist. And I think that number is probably reflected with faculty and staff, more faculty and instructors. So for us to be able to really kind of put our name out there was important. And just opportunities to collaborate, whether it's in-house with other departments or our public health that is focusing also on substance use and tobacco use. So these are just the learning opportunities and the prevention efforts that we've taken on as a team. This effort started really around 2021 when we were approached to kind of work through getting us to a tobacco-free policy. Symphony, did you have a question or comment?
Yeah, I'm only seeing your first screen. I'm not sure if maybe if you full screened it, I'm seeing the first slide, and then I see your next slides coming up, but if you're moving through your presentation, I'm still only seeing the first screen. Yes, I can see it move now.
Okay. So let
Awesome.
me know where I'm supposed to be. Sorry about that.
No worries.
They're not really beautiful slides, so you're not missing a whole lot. I'm just kind of reading off of them. Okay, so it should say learning opportunities and services.
Yes.
Okay, good. So this has a lot of information, so I'm glad you let me know this. So this gives you kind of a sense of our timeline and the efforts that we've made as a group. So We did a training with SAMHSA on how to implement the YSBIRT model. So that's youth screening to brief intervention, youth screening, brief intervention, and referral to treatment. So as a team, we did this training and tried to figure out how to screen our students and identify tobacco and other substance use. We also did a motivational interviewing training with them. We've done this before, but it's always a nice refresher. We've been for many years doing universal screening on all of our students with the PHQ-4 to identify depression and anxiety symptoms, but we decided to implement the S2BI screening, which stands for Screening to Brief Intervention. We learned that through the YSBIRT model. And that S2BI was really kind of the cornerstone of this work, because it's the first step in knowing what our students are using, what they need, and it opens the door to that conversation. And that was, again, a recommendation through YSBIRT and their model, and that's embedded into our medical record. We have Pyramid. So for every student that we see, that is an encounter, a part of that encounter that comes up, so it needs to be addressed. Also allows us to pull data, so then we know what students are answering and responding to. We received, of course, the mental health allocation that allowed us to expand our work and really tailor services and think about substance use and tobacco use. We have a wellness coordinator, ambassadors, mental health clinician, and various events we're putting on. We did our Healthy Minds study last year through a partnership with University of Michigan, and we found high marijuana use. So that's going to be a real focused effort coming up here with outreach, also vaping use, and then mental health, of course. We've had presentations through CYAN. Those were great. We really strengthened our knowledge of Kick It California, Truth Initiative. We've got presentations through what we call our Healthy Living series. We record those, lots done around mental health and substance use, and specifically tobacco. We do tailored outreach, as I mentioned, really because it's more data informed from our Healthy Minds study. We get the quick kits from the state. Those are great. And then recently we implemented the Campus Opioid Safety Act. So as we're talking about opioids, we're talking about other substances. So this work is just so integrated when it comes to tobacco, substance use, mental health, opioid use. We just try to cover it all. And that's really leveraged that conversation on campus. And through all this work, our alcohol, tobacco, and other drugs reporting just looks great. We're doing so much more work here. And as you can see, our policy was passed, and now going forward, we're working on vending machines that were installed last couple weeks. We're in week 2 now, and we are going to be giving quick kits for free in those machines with some sort of pamphlets that we have on those machines as well that students can grab. We have medical directors coming on next year that are new. They're actually focused on substance use and harm reduction. So we're going to be integrating a lot more work around tobacco and substance use. I mentioned the Wellness Center. We're going to be participating in a research project, continue to evolve and implement best practices, evaluate our screening tools, because as these evolve, I'm sure screening is going to look different based on the new substances and emerging substances coming. Collaborating with the county, now that it's their focus area, we want to be a part of that effort. And then Healthy Minds study has just been great. We hope to relaunch that in a couple of years and just use that really rich data to, again, develop better and more focused programming that's relevant to our campus. And that's all I have.
Okay. Thank you so much for your presentation, Amy. I'm so excited. It's honestly so inspiring to be able to hear that our colleges are actually working and that we have hope for our future regarding substance use and tobacco use on our campuses. I'd actually like to pass it on to Jennifer Taylor from UC Santa Barbara to talk about the work that it's being done on her campus. As a fellow UC student myself, I'm super excited to hear about what you're going to be talking to us today.
Thank you. Thank you so much for having me. Amy, thanks for the presentation. I want to get more information about those vending machines with the quick kits. That's the first I've heard of that. That's really exciting. So, I'm going to share my screen. I don't have a PowerPoint presentation, but I do have a lot of materials that I was hoping to share just as I'm talking. So again, my name is Jen Taylor, she, her pronouns. I've been with UC Santa Barbara since 2012. We've been a smoke and tobacco-free campus since 2014. And during my time there, I've seen a lot of evolution in terms of the way we've approached nicotine on campus, the treatment of it. So I'll talk a little bit about that. But before I go ahead and do screen share, I'll just kind of give you a little overview of how things are structured on our campus. So I am a licensed MFT. I'm a behavioral health therapist. I work with the Alcohol and Drug Program, which is a program within the umbrella of our student health services. So we're actually located in the student health building. It's great because it really gives us a chance as part of the behavioral health team to consult with psychiatrists, especially around NRTs or additional medications for those students we're working with who are interested in cutting back or quitting nicotine, and to be able to just really collaborate as a team, with other providers, with the social workers. So it's a nice arrangement. We're kind of unique in our campus in having a dedicated alcohol and drug program. We're a team of 5 licensed therapists. We do a lot of mental health services, and often, as you all know, that often people come in for nicotine use, but there's also maybe some co-occurring issues going on. So as part of our protocol, we always, just assess for other concerns, other case management needs, that kind of thing. We definitely use a harm reduction approach. So we always are very clear that we don't have an agenda. Of course, we always promote safety, but we really try and meet students where they're at. We try and be a really warm, welcoming place. We're generally set up for short-term support. Sometimes we can meet with students a little more ongoing. We also use a lot of motivational interviewing in our work. That's a frequent training I offer throughout campus, especially within student health. Usually yearly, or at least every couple of years, we try and offer all of our new employees some motivational interviewing training during their brief encounters with the students who come in for services. We've really pushed for universal screening. So generally, providers are always asking about nicotine use. They're always, assessing for other concerns related to substance use as well. So a lot of our referrals for nicotine, our Call It Quits program, which is, support for cutting back or quitting nicotine, come from within student health. So a student may come in and have an appointment. It comes up that they're smoking or vaping or using nicotine in some form. And a lot of times they're interested in quitting. And so that referral is really nice because they can go ahead and connect them to our program by just scheduling them an appointment, since we all share the same charting system, or at least providing them maybe a quick kit or a handout so that students can follow up on their own. A lot of students will find us just on their own through a search or word of mouth, or maybe they have a friend who've gone through the program. So that's just a little bit of the layout. In terms of prevention and education, maybe I can kind of start with that. Let me go ahead and get going with sharing. Let me see if I can. Okay, is everybody able to see my screen?
Right now, all we see is a blank screen. I don't know about anyone else, but it's just blank on the side.
Let me stop sharing and try again. Are you able to view anything, or is it still showing up as blank? Okay, I'm getting a couple nods. All right, so we also have a student-run organization called Life of the Party. We have student interns who work with our program every year. They are quite instrumental in a lot of our prevention efforts. So, for example, one of our student interns developed this great flyer that we use. We have these printed out on quarter sheets. We include it in all of the quick kits. We'll have it with a QR code at a lot of tabling that they do throughout campus. We have flyers up. We have these on what we call Digino, where a lot of places in like the dining halls and the residence halls, or in student health, as students are waiting for appointments, they'll see advertising for these services pop up. So it's really our effort to get the marketing out there that these services exist for those students who want help. And we'll, really emphasize that we're able to connect them to getting NRTs at no cost to them, either through their student health insurance or through our supply that we're able to keep in the office. And that's also a really big draw, since a lot of students recognize very quickly these products are expensive. So I wanted to share that. And then I mentioned this Life of the Party is the name of that student-run organization. They do a lot of really great social media posts, pulling in I mean, anybody who's got Instagram can look them up and take a look at these on their own, but they'll just throughout the year, be posting these, this kind of content. And at the end, it always really encourages people to look into. I wanted to share one more. We're starting to really also do kind of more of a push for the connection between mental health and nicotine, since we find a lot of times students may start to discover after using nicotine for a length of time that it's exacerbating or making their anxiety or mood issues worse. But we're really trying to highlight, some of the connections between those things, just since, we find students are often really interested in the research and, all the different ways that it is, affecting their well-being, their health. So I think we have like a 2024 encouraging people to think about, with the new year quitting. So I just wanted to highlight that. And let's see. I also want to talk a little bit about the treatment, because that's a lot of what I do, is actually working with students. So our protocol usually is, if a student gets referred, we meet with them for a full hour for the first visit. There's usually a lot of information we're gathering. We have developed this questionnaire that really kind of pulls from a few different questionnaires. We kind of pull in some Fagerstrom scale content, but we have students fill this out on their phone or on their laptop before they ever show up for that first visit, and then it populates into their patient, portal, their chart. So as we're writing the note, all of this content that they've completed is already there. So we're able to review it before we can call them into the room. But it gives us a sense of, what they're using, how much. We do ask them to try to calculate how much nicotine they're using per day. And I know, Amy, you mentioned that is a tricky area, and it can be for us too. And a lot of times what it is we'll, say, okay, well, what device are you using? And we'll actually do the calculations with them. What strength is it? How many milligrams is it? We'll do that kind of multiplication over what time frame we're using it up. Okay, 2 weeks. So we'll divide it by 14 days. And then we get an approximate amount of nicotine use per day. And then we do our best to try and start them on some NRTs. It can be tricky, especially if they're sharing devices or they're really not sure, or maybe they're using different devices each time, but we can always adjust up or down. We always let students know, these products are available over the counter. They're generally pretty safe. Of course, they can use too much nicotine and have some effects that aren't great. But that's often a part of the work we do in that first visit. And then we just look at a lot of information, like, did they try and quit in the past? If they did, how long were they quit for? What helped during that time? What led them to kind of fall back into use? What's their motivation level? And then, these are the instructions we give for, calculating that nicotine. So I'm happy to share a lot of this content if this is helpful for anybody doing this work on their campus. And then I don't necessarily, this is our protocol. So, it's just all the steps we go through of kind of asking the questions, talking about, the basics of developing a quit plan. So, coming up with a date, making sure it's hopefully within a couple weeks, so they're not pushing it too far out since motivation's high and we want to strike while the iron's hot. Having them ideally get rid of all their products, talking to the friends, family, all the people who support them. Just really having that preparation, thinking about not doing it during an especially stressful time if they're right in the middle of midterms, but just kind of trying to set them up for success. We also do, again, additional psychosocial assessment. We used to actually have our peer interns do the cessation work, and it was successful in some ways, but we were finding oftentimes people were coming in with issues and concerns and needs beyond just the kind of basics of the nicotine cessation work. And so in the professional staff taking this on, and people who are, kind of licensed clinicians, were able to also, address maybe some depression, anxiety, other things that may be going on for them, in addition to the nicotine work. And then follow-ups are usually pretty brief. Sometimes we encounter students who are a little more complicated, or students who aren't quite ready to quit. And so, we're talking about strategies for cutting down, maybe connecting them to, one of their, like if they're working with a psychiatrist or other provider, again, to talk about medications that are outside of the scope of what I'm able to help with. I realize I'm getting kind of long-winded, but I wanted to mention how we handle the NRTs. We do have a supply in our office. It's really helpful. So if somebody's really motivated and wants to start immediately, and we don't necessarily even want to have them wait a couple days for us to put in the request to one of the psychiatrists and pick them up at the pharmacy, we can go ahead and give them a few patches. We can give them a vial of the lozenges, or some nicotine gum, or even both if they want to try and sort of figure out which one they want to use most. And then what we do is we have a psychiatrist that we coordinate with, we just send a secure message. Please go ahead and write a prescription for the student if they have the student health insurance. He does that. It goes straight to the student health pharmacy, and then at no cost, the students are able to pick up those NRTs and continue to, put in those requests as needed. So it's a really streamlined system at this point. It's taken us a little bit of time to get there, but it seems to work really well. I think there's one other maybe I deleted already. Oh, these are just all the forms I've kind of created a packet of stuff that we go through, and it just helps guide the appointment. So, a lot of strategies for, as I mentioned, for getting ready to quit, strategies for managing urges and cravings. On the back side of this document, it's, looking at all the different triggers. I'm trying to think what else is on there that would be helpful. A lot of this was pulled from the, what is it? I have it down there at the bottom. I think it, Quit California, no, smokefree.gov. So, knowing triggers, looking at the reasons for quitting to increase motivation, dealing with slip-ups, letting people know not to get discouraged. That's often a really common part of quitting. We hand out meditation resources, strategies for coping with stress and anxiety, since it can be especially that first week or two, can be pretty tough. We talk about NRTs, explain how to use them, talk about withdrawal symptoms, what to expect in terms of those. And then we hand out this nice urge surfing document as well. So I think I've given a lot of content, but that's kind of what I wanted to share. But happy to answer any questions. I know I focus more on kind of the nuts and bolts of how are we actually treating students. Other ways that we're getting the word out there, we do a lot of presentations. Sometimes we're invited to classes on campus where we'll talk about nicotine. I regularly will get up in front of the student health service and talk about kind of trends and what we're seeing, just to remind our providers about our services so that they're sure to refer students. A lot of our, again, our student interns will do just events throughout campus where a lot of times during tabling, they have quit kits. Thank you, CYAN, for always giving us those. We do the Great American Smokeout, Earth Day, a lot of our other events throughout the year. We just have that available. And I hear the quit kits are very popular. So we often go through a lot of those, handing them out on campus. So that's all I've got.
Thank you so much for your presentation, Jennifer. That was amazing. As a fellow UC student myself, it's so exciting to hear what other campuses, especially campuses similar to mine, are doing. That was very inspiring. As a reminder to all the attendees, all the participants of the webinar, we see your questions and we appreciate your questions. But just so everyone or all the panelists have time to answer at the end, we will be answering questions at the end, so everyone does have a chance to answer. But I definitely want to hear more about Amy's quit kits, especially through the vending machines. Okay. Now I'm going to be passing it on to Natalie Townsend from the University of San Francisco to talk about the work on her campus.
Great. Thank you again for having me, and Amy and Jen. Awesome. Great things that you're doing over on your campuses. So I have a slide deck, so let me share my screen. Cool. Everybody can see that? Great. I see some thumbs up. So as I mentioned, I'm Natalie Townsend. I'm with the University of San Francisco. I'm the Director of Health Promotion Services. So we don't have a clinic on campus, just like Amy and Jen were saying. So we actually, we're situated a little bit differently. And so we oversee our department, Health Promotion Services, everything from the student health insurance, our contract with the clinic that we have a partnership over at Dignity Health, all of the immunizations, but then also all the programming and things like that, which includes smoking cessation and those sorts of things. And so I'm going to talk a little bit about historically where our campus has come from and where it is now regarding, the projects that we've done, the things that we are currently doing in regards to stop smoking and treatment on our campus. There we go. And just a little context, we are a private Jesuit Catholic university in the heart of San Francisco, so just across the bay from where Andrea is at. We're kind of a small, big school. We have right now just over 9,000 students. That includes grad and undergrad, and all of our additional campuses that we have. So we're unique in that regard. And so kind of when it comes to policies regarding stop smoking, we kind of, I don't want to say can do our own thing, but we have a lot of autonomy in regards to what our policy looks like. And so just some historical context. So I've been here at the university for going on 9 years, almost 10 years. And so when I stepped into this department, we didn't have a smoke and tobacco-free policy, but we were getting a lot of complaints from students as well as faculty and staff in regards to these designated smoking areas. We eventually evolved that, and, you know, we're really trying to push in kind of removing those designated areas, and we did. But then it just started moving to the boundaries of our campus, and maybe some of you are very familiar with that. So along the sidewalk, and, you know, students would have to walk through plumes of smoke to get to class, et cetera. It was just like an eyesore. And so we kind of came to the point now where we're getting kind of these, you know, grievances from everybody. It's like, okay, we need to kind of start putting our money where our mouth is and kind of implementing a smoke and tobacco-free policy completely on our campus. So within one of our committees on our campus, that I'm a part of, the Health and Safety Committee, we started talking about, you know, how can we do this? CYAN was fantastic. I cannot, you know, stop giving them so many kudos in regards to like kind of looking at policies that were there, what's happening on college campuses, et cetera. And so we worked with them a lot, as well as we decided to create a little subcommittee, so a clean air task force regarding what this policy is going to look like. And so we went and did a roadshow explaining, you know, the benefits of this, and our president agreed and signed a policy that went into place back in 2017. Simultaneously, at the same time, our campus received a tobacco-free generation campus initiative, and that was through the American Cancer Society that myself and our department wrote. So we were able to receive a $20,000 grant to kind of catapult us into this smoke and tobacco-free policy. And that really kind of was the impetus, I think, to kind of have our president sign this new policy. And that was great. And having those funds was very, very helpful to help us hire some peer health educators, get, you know, NRTs, get stuff for our quick kits and that sort of thing. And so we've been, you know, smoke and tobacco free for, you know, not quite 10 years, but almost, you know, 10 years on our campus. And it's been really, really great. We have seen, obviously, tobacco use change. We are in the city, and, you know, Juul was the hottest thing on our campus back in 2016, 2017. We could not see students walking around with them, especially, you know, again, just it was readily available everywhere. It was wild. So with that grant that we received at that time, we created this ambassador program. And so these students, you know, maintained and educated our campus about our new policy. They would kind of do some monitoring around hotspots. So taking stock of, you know, where were those hotspots on our campus, and providing that data, and really kind of engaging with students in that area regarding resources and that sort of thing. They would also implement monthly cigarette butt cleanups on our campus. Again, we wanted to really make this a collaborative approach. So we really pulled in our sustainability department and our environmental department as well, regarding kind of more of a holistic approach, that, again, it's not just the smokers, but it's also the environment, especially, you know, with those little pods that, you know, go excess, as well as the cigarette butts and that sort of thing. And we also they also conducted one-on-ones with students who are interested in quitting tobacco. So again, those motivational interviewing techniques and that sort of thing. And I'll go into more detail about that training with them. And again, and also just data collection. Again, you know, utilizing those hotspots, how many times they would see students smoking and that sort of thing, from more of an observational standpoint. And so it kind of gave us an idea of where on our campus we saw kind of, you know, congregation of students and that sort of thing. So when we started, hiring these ambassadors, they did go through some training. So they did the CYAN COF certificate training, as well as they went through the NASPA certified peer education training as well. And so myself and other people on my staff also did additional training around just brief motivational interviewing techniques, the AIR approach, so in approaching someone, informing them and referring them to resources that we have on campus. The scale of openness, that was actually from San Francisco State, a really, really great scale that was brought to my attention when I was talking to other campuses in regards to like how to approach a smoker, ways to engage them and not be threatening. And then again, the 5 A's again. So a bunch of different strategies that we trained our students in at that time to kind of work with students, engage with students, again, regarding our smoking policy or non-smoking policy and vape free. And so that's a picture of like one of our signs that we do have on campus. And I guess I'd be remiss. So prior to us getting smoke and tobacco free and with the grant that we received, our Office of Marketing Communications wanted to brand this. And so they created that Breathe Easy USF campaign for us. So now everywhere on all our digital signage, on our actually our athletics basketball tickets, you see that Breathe Easy USF everywhere. So everybody is very aware of that campaign. And again, that we're smoke and tobacco and vape free. And again, just some, kind of resources and things. And so, we had that grant, it was fantastic, but we needed to be sustainable. And so one really great thing that we have also implemented now is we have a really great partnership with our Masters of Public Health. And so myself and my colleague, we teach a couple courses, and with those students, they have to do 50 hours of part of their, curriculum. And so a part of that is we have a dedicated group of those students who do alcohol and other drugs. And part of that is also nicotine and tobacco use. And so they now they have set workshops. They meet with students one-on-one as well as Masters of Public Health students, and do one-on-ones via Zoom, as well as, if we do offer free NRTs, so Nicorette gum and lozenges. So if they do want that, it's kind of dangling that carrot, if you will, they will then have to meet with one of our Masters of Public Health students in person to go through, what those are, how to utilize them, and educating them on those NRTs that are available to them. And those are some of my ambassadors, in previous years. And it's important, I think, for outreach. I mean, again, I'm sure not unique to many of your campuses in regards to how you're doing outreach, but collaboration is extremely key. Again, we don't have a clinic on our campus. So when I do meet with the managers over at our clinic, I'm asking them regarding and, trends that they're seeing with the students that they do meet. And again, making sure that they have our campus resources within our office that we have available to them. Again, our social media, again, workshops that I've talked about, again, our one-on-ones and everything. And again, the great collaboration that we still have with our MPH students. And again, I think the peer-to-peer approach is fantastic and great, and research show that it does help. But I think now that we've kind of grown from the early stages of our adopting of our policy to where we are now, I think having graduate public health students who have more of that, theory-based knowledge in regards to the public health and whatnot has been really, really beneficial in kind of moving us forward and allowing a continual peer-to-peer support for our students. And then just kind of a workshop, these students curate and create these all on their own. And again, with the realities of Zoom as well as in person, our our students realize, like, you know, you can't have a student sitting in a room or a virtual space for, you know, an hour. So these are really quick vignettes of presentations on what tobacco use is. Specifically, this one is about vaping. And again, trying to be really interactive with them in regards to, you know, different types of modalities when presenting to their student body. And again, these are conducted throughout the academic year. And again, the Great American Smoke Out, just ideas and things that we've done in the just actually this past academic year. Again, a lot of collaboration with Dignity Health, the clinic that will come. Again, also bringing in Refuse, which is also, they do cigarette butt cleanups around San Francisco in general. And so we always invite them to our events, as well as, you know, Earth Day and that sort of thing. Providing, you know, cold turkeys, again, just to get engaged with students in regards to the resources that we have on our campus. And then we also always invite our nursing students, and they do spirometer tests for students, and do, you know, basic vital checks with them. And this is some photos of our Great American Smokeout just this past year. And one thing that we've done in the past has been really, really helpful. We did like a testimonial. So we had a couple students who were previous smokers and vapors, and we did it through kind of like a webinar setting where they just talked about their relationship with tobacco and the ups and downs with trying to quit. And it got a really, really great feedback. And I think it's, you know, it really kind of validates those students who are trying to quit, and that it is, you know, a struggle and they're not alone and it is doable. And then that there is support available. So that was a really, really great thing that want to try to continue if possible. And then I want to also talk about when we were, you know, working on getting this policy passed, if you could see in the visuals, we worked very closely with our international students department, because we did notice a lot of international students were smoking, you know, cigarettes and that sort of thing. So we really wanted to make sure that they were aware of this change happening on our campus. So I would meet with the president of our International Student Services, and he was amazing and gracious. And he's like, I'll translate this for you in Mandarin. And so they translated it for us and they put it on their WhatsApp. And that's how most of those students communicate. So again, you know, meeting people, you know, collaborating is really, really important. Again, wanting to make sure that everybody on our campus, key stakeholders, were aware of what was happening. And again, just some challenges, I guess, you know, like we're navigating this hybrid world now. I mean, we were 100% in person, and so pivoting, you know, kind of presentations, that sort of thing. You know, sparking engagement and reinventing ourselves. Again, that's, you know, sometimes you know, you're kind of just like rinse, recycle, reuse. And so sometimes it's nice to get, you know, different perspectives. That's why I love working with our students. You know, something that we've also noticed is just like outreach information overload. You know, again, you can make a horse go to water, but you can't make them drink. You know, and so we see that a lot. And so again, how do we reinvent that outreach? And I can't, you know, give enough kudos to the students that I work with, because, you know, I'm always asking them what's happening on campus, what are the trends, you know, what's new, you know, and like, well, I think I have my colleague on here, you know, so we'll ask them, and, you know, if it sounds feasible and doable, we'll, you know, give them the opportunity to try something different and new. Again, I can't stress this enough, collaboration in all multiple departments, from students to leadership to Greek life to, you know, the clinics is great. Giveaways are always awesome as well. Our students love the quick kits, and it's low cost. You know, we do have funding for that, as well as the NRTs. We have funding as well. That's no cost for our students. So if they want it as many times as they want, you know, we'll provide that to them. And again, you know, obviously having our Breathe Easy campaign has been very beneficial. You know, it's our trademark, and so everybody knows what it's about, you know, expectations and that sort of thing. So again, some successes and things to think about. Yeah, I think that's it. Anything I shared, please feel free to ask. I'm a total open book. You know, and so happy to ask or answer any questions you all might have. Thank you.
Thank you, Natalie, for that presentation. That was so inspiring. As a peer educator myself, it was so amazing to hear how you involve nursing students and grad students in the effort to make your campus more smoke and tobacco free and to encourage your students to quit. I'm going to be going through some of the questions that some of our attendees shared. As a reminder to any of our attendees, please feel free to add any questions. We'll be looking at them and hopefully you'll have your answers from your panelists. Okay, so the first question, maybe we can start with Amy. Are you able to share a sample of your quick kits? I'd also like to hear about how like the vending machines specifically are working on your college campus. And then maybe we can go Amy, Jennifer, Natalie.
Yeah, we may all have the same items, but I actually grabbed the bag that we had. This fits really well in our vending machine, but we also just use these with outreach. So we always make sure we have some information at the front that says apps and resources to quit vaping and tobacco. And then inside there's lollipops and gum and tea and a pen and a fidgety spinner thing. Let's see. There's, gotta dump it out. Toothpicks, one of these like little poppet things. So just like little toys and things to sort of play with to distract you, to, you know, help you in a light way with your quit attempt. But really it's the resources that we put inside, information that comes back to health services if they want to come back and talk with us, Kick It, California, and then Truth Initiative information.
Okay, perfect. Jennifer, I don't know if you have a quick kit or do you have any visuals that maybe share?
I don't. I'm working remotely, so I didn't bring a quick kit, but it's essentially the same items Amy named. So it's, you know, just again in the little, you know, clear baggie. I think it's the stuff that we've gotten from CYAN. So, but what I wanted to add is one item that's been really popular, and actually years ago, I think we had some funding maybe from the county that we needed to use up. We bought little vials of these mint like toothpicks. Those are very popular with students. So when they're trying to quit, that, you know, behavior of like the hand to mouth, you know, that they're trying to quit. Of course, we talk about getting crunchy snacks and just, yeah, candy, gum, like anything. But being able to chew on something, a lot of students really find that helpful. So I'm always giving those out. And especially if I'm meeting with them in person, I'll throw one of those in, or they'll come back and say, can I get another one of those little ones? So I don't know if they're still for sale, but those have been really helpful.
Okay, thank you. Natalie, I know you told us that your college campus is a private university, so they might look a little bit differently. If you have a quick kit available, do you mind showing it to us?
I don't,
Or-
it's outside of my, yeah, I don't want to like leave. But just something I like to add is we also pretty much some of the same items, but we also, I think the orals are great because we do put suckers. But one thing when I talk with students, we always put honey sticks in our bags, and those are really, really great for students, as well as, you know, as Jen, you mentioned, like toothpicks, or we have those as well, or we have had those. And we also put in like a little notepad regarding their triggers. And so we really try to emphasize, like, you know, jot down when you do have a trigger, you know, when you have that sensation or that urge to smoke again. So when we meet with them, we kind of can take a look at like, okay, what's the environment you're in at that moment? You know, what triggered you to kind of have that urge to smoke? So we also put that as well in our quick kits.
Perfect, thank you. This is another question asked by Victoria. I think this one might be directed to Jennifer, but if anyone else wants to share, please feel free to do so. The question is, if you could share some of the medication calculations for vaping, that would also be great. And then just more elaboration on the quick kits.
I'm going to go ahead and put, I can put it in the chat, and I'm happy to share it afterward. Maybe it's going to be too long, actually. I'll try, but if not, I can send it afterward, kind of the how to do the calculations.
Perfect.
Hold on,
I
let me
think
try
that
one
might
more
have also
time.
been an older question, so I apologize to the attendees. Yes.
Yeah, I think it's too many too lengthy to put in the chat area, but essentially what we do is, I mean, I can kind of just read through it. You start by checking the package or website. You want to get the strength and quantity. Nicotine amounts are often listed as a certain amount of milligrams per milliliter, so required that you multiply like however many milligrams by the total amount of milligrams, sorry, by milliliter by the total amount of milligrams, and then you divide it by the number of days it takes to finish. So for example, an ELF bar BC 5000 has a nicotine strength of 5% or 50 milligrams per milliliter, and an e-liquid content of 13 milliliters. So in total, there'd be about 650 milligrams. And then you divide that by the number of days it takes to finish. And what often happens is, I guess in a joule, it would be, I'm just kind of reminding myself, it's about 40 milligrams of nicotine per pod. So you would divide that by however many days it takes to go through it. I know joule is not as popular. A lot of times what I'm finding is that, I don't know if this is helpful, but students will be really surprised by how much nicotine we're calculating that they're using per day. These products are strong. There's a lot of nicotine, and the way they're formulated, as you probably all know, are that, you know, it's a pretty smooth experience. And students can be using really high amounts. What I've learned from the psychiatrists we've worked with is that oftentimes their body is not addicted to that full amount necessarily. But sometimes we may work on just titrating down and bringing, you know, reducing before we start the NRTs. And otherwise, we'll just start at the highest level of NRT, you know, with and usually do a combination of patch and the 4 milligram lozenge or gum in addition to that. And then we'll just kind of track, you know, how much they're using initially as a baseline, and then kind of start working down from there. So I don't know if that helps, but it is a tricky calculation. And what I can do is send that, you know, that information afterward, and you can maybe forward it out to people or anybody who wants it.
Okay, perfect.
I just wanted to add something to that, because I had mentioned in a slide and that you know, we're not doing NRTs out of our health center, and I don't want to deter anybody from exploring that because it's so important. And it's really just because in our center, and this can be pretty common across the community college system, we all look very different, but most of us are pretty small. You know, we don't have a on-site physician. We don't have a full-time in-house mental health provider. We have no health educators. We have some student sort of health ambassadors, but the capacity and ability for us to pull that off can be really challenging in our system. And we're all RN run. We're not even advanced practitioners, no nurse practitioners. So, you know, we have this sort of limited scope. So, but we're going to still explore and see what we can do and focus our efforts a little bit better. But just wanted to throw that out there. Thanks.
Okay. Thank you. If there's nothing from Natalie, maybe we can move on to a different question. Okay, perfect. Kim also sent in the chat that CYAN has these quick kits for colleges and universities. So you can just feel free to email Symphony if your college would like quick kits. And then she also put the formula from the Stanford Tobacco Free Toolkit in the chat. Excuse me. So the next question I think is directed to Amy. Hello, Amy. Congratulations on the big win at Modesto Junior College. I know you mentioned earlier that one of the resistance you faced in the beginning of the smoke-free campaign came from union workers. How did you respond to that? And do you have any tips to help engage with these pushbacks in a considerate and effective way?
Yeah, I wish I could say that I was in the room, and I wasn't. It really was taken on by our HR team, our president, sort of higher leadership. I know that with the team that we had from the California Health Collaborative, they were very, very helpful in developing talking points for the team. Those were who were in the negotiations and having those discussions. Were really armed with some great, accurate information from those folks. So I would just sort of encourage, you know, those who are trying to move that conversation forward to just reach out to those who are experts in the field and have great information right there ready to give you.
Thank you. Again, feel free, attendees, feel free to ask any questions in the chat. We'll be constantly checking it. We're gonna be moving on to some questions for, feel any of you three feel free to answer the questions. But one of the things that we wanted to ask is there any type of cessation services that students are interested in getting support from? So we've heard a little bit about, what students know about, what's accessible. Do you guys notice a specific interest in certain cessation services over others, and like what do students tend to gravitate the most towards? And anyone feel free to answer the question.
I'll hop in, and I think, I mean, more and more the trends that I am seeing more recently is, you know, multiple students I meet with have tried to go cold turkey. And maybe it's just they don't have the support. They're not actually really ready yet because life happens in, you know, stressors, that sort of thing. And so they come back around and they're now more open to try the NRTs. And so I have seen an uptick in regards to disseminating that from my office. One thing I always offer as well is like a support group, and that never has really been, it's always like a quick no. You know, it's an option and available, but it seems that, you know, if it's, you know, there's no interest that I've seen in the time that I've been here regarding like group support regarding, you know, tobacco cessation. And maybe it's just, you know, they find that, you know, it's just them, they need to figure out what works for them in any regard. But that's kind of like the trends that I'm seeing over here with our students. And I'll be honest, we are seeing more marijuana use than actually tobacco use. And so that's a big trend. And I'm always talking and working with our student conduct office to see, you know, what she's seeing in regards to kind of conduct cases when it comes to marijuana use, as well as tobacco use within just off campus as well as in our residential halls.
I mean, I'll jump in. I don't have too much to add. I would say that NRTs are also a really big draw for students. I mean, we see students at all different points along the journey. Sometimes most of the time there have been some effort to quit back or to quit or to kind of tackle things on their own, and it either it hasn't lasted or just didn't go very well, or they tried a cold turkey approach and just found it was a real struggle. And a lot of them are surrounded by friends or housemates or roommates who are still using nicotine, which can feel like a barrier, can be a challenge. So a lot of times those NRTs can just really sort of boost both their confidence, and then of course, you know, with just mitigating the withdrawal and the discomfort of quitting, can be incredibly helpful. I feel like you said something, Natalie, that got me thinking, but I'm not sure what it was. But I think I did want to mention, you know, just in terms of populations, you know, I know over the years we've made efforts to really kind of target certain populations too. So for example, we have a really robust recovery community that was started by one of my colleagues on our campus. I know a lot of campuses now are starting to develop, especially depending on their size, and develop recovery services. But nicotine use is often quite high in the recovery community. And so when we did have a dedicated student intern who was offering those services, that person would show up to those meetings, offer pizza, just really be a warm, kind of welcoming presence. And just, you know, it was a very sort of a gentle invitation of, you know, students would often leave the Gauchos for Recovery peer support meetings to go vape or smoke. And so, you know, there was just that kind of reminder of these services are there. And we did get some students who came in. And so Natalie, when you were talking about it, reaching out to, I think, international students, it got me thinking about, you know, those kinds of special efforts to connect with different populations where rates of nicotine use often are higher, can be really helpful and effective. I also I'm going completely off topic, but want to mention that we also did have I didn't talk about it when I was presenting, but we instituted an ambassador program funded, I believe, by CYAN, and they offered the training and the resources to get that up and running. And I partnered with one of my colleagues over at our health and wellness program here on campus. It was pre-COVID, so it feels like a lifetime ago. But it really was quite effective at starting to chip away at those folks who were congregating in certain areas on campus. To be honest, I don't know, other than National Collegiate Health assessment data that we get, I think every other year, what the rates of use are on our campus. And we don't have that kind of boots on the ground, presence on campus really approaching people using nicotine. I know just anecdotally from students, it still happens. But, I think there's good awareness that our campus is smoke and tobacco free, but it does still happen.
Perfect. Okay, we'll be moving on to the next question. This is for any of the attendees. Does your policy have any kind of student conduct component? What strategies are you using when it comes to policy adherence? This has been on point of discuss that has been hard for campus to navigate from an administrative level. In the chat, so what policy does what's your student conduct policy component, essentially?
Yeah, I could jump in. So, as we were kind of putting together our policy, we made sure that our director of student conduct was involved in this conversation, because it's called the fog cutter. All of our students sign that policy when they come in. They don't read it, and they're just signing away. And again, so just emphasizing that is part of the student conduct. And so our RAs and RDs were very well aware of this new policy that was getting implemented in 2017. So again, providing enough resources as well as visuals of like, this is happening, etc. And so if a student is caught with, tobacco paraphernalia, smoking or vaping, they do go through the conduct process. And so from there, they'll meet with one of the conduct officers, kind of do more of an educational approach of like educating them on the policy, here on our campus, as well as just briefly a little bit about their smoking, in their relationship with tobacco. If it is extreme and there's like maybe some more comorbidities and other things going on, they will probably refer them to CAPS, our counseling and psychological services. If it's maybe a first-time offense or something, or they think that, just meeting with someone from my office and just doing a brief motivational interviewing session with them is beneficial. So I'll meet with them. And if they don't, they'll get a hold put on their account, that sort of thing. So there is consequences if they don't follow and go through their due process with, if they are smoking on campus or that sort of thing. And so again, we have a really great rapport with our because we're also a small campus. We have a really great rapport with them, and they always will refer us to students, even if it's an alcohol sanction. If there is smoking involved, we'll refer students to do another BMI with myself or one of our Masters of Public Health students. So.
Amy, Jennifer?
Yeah, mine, I can just be really short here, but because our policy is so new, we have yet to see much coming up in terms of violation of policy, but we don't have campus police. So our campus safety officers all carry cards that give some education around, where to get resources, whether it's health services or outside of here. So that's kind of the tool that we're using now. But yeah, if there was any violation there, we would go through a conduct process, and our conduct officer was informed on, and involved in the policy change. So, but so far things are pretty smooth.
I wish I had from our campus more to report in terms of there being a conduct response, but when there is nicotine use, whether it's in the residence halls or on the campus property, to my knowledge, there's no real response in terms of conduct. I suppose I'm not even sure if there are campus officials. I think sometimes staff members will take it upon themselves. I know we had a nicotine kind of a task force that was in place again pre-COVID. It never really got off the ground. I wasn't the one in charge of it. It was my colleague at Health and Wellness. And there were some very passionate staff members who, were very direct when they noticed people smoking or vaping on campus. But outside of that, unfortunately, I think a lot of it, just occurs without there being any consequence. So I know in the residence halls, I mean, we don't tend to get referrals about nicotine. I don't know if that's because it's just easier to conceal, or it's just doesn't reach the level of being sort of written up. We do get a lot of referrals for people using alcohol, cannabis, other substances that are, of course, against university policy. And those students have to meet with us and either go through one of our group programs or individual appointments.
Perfect. We do have another question in the chat. Feel free to keep on sending questions. Whoever might like to answer first, please go ahead. Which NRT products are you finding students are most interested in using? Patch, gum, etc. Maybe Jennifer, since you're already.
I'm happy to jump in. It's very individualized. I would say, again, just anecdotally, probably lozenges tend to be the most popular. I suspect because with gum, you have to be a little bit more particular about how you use it. There's some very specific, ways of chewing it and then parking it, and then, and then lozenges, I think it just takes a little bit less effort to kind of, follow the directions of use. But often, again, with, the level of use students are coming in with, I'm recommending a combination of patch and lozenges or gum. Those are the three types that we tend to recommend. If students are interested in something else, we'll usually refer them to one of our medical providers. But yeah.
Natalie, Amy?
That's funny. Most of the students, we only offer lozenges and gum. And maybe it's the flavors I'm getting, but most of our students actually prefer the gum, and maybe it's just the chewing, and so you're not chewing it like regular gum, but I don't know, they seem to gravitate more towards the gum than the lozenges in here at USF. So
Amy?
Well, we aren't giving NRTs at this time, so I don't have anything to contribute.
And just to amend my answer, I would say students use both. Probably recently, for whatever reason, the students I've been meeting with like lozenges, but it is so particular. And yeah, I mean, to your point, some people actually do like the more active, chewing mechanism.
Perfect. I think if no one else has any other questions, this might be our last question. But how does mental health impact a student's likelihood of using tobacco and cannabis products? And this can be for any panelist as well. Maybe Natalie, if you'd like to start.
yeah, no problem. I mean, and I think so when students walk through my doors and, there is correlation with, tobacco use and stressors, the mental health load that, a lot of these students were in the midst of their high school or 8th grade through COVID. And so a lot of them lost that social, or were in that social isolation. And we do talk about that and those stressors that they are experiencing. And so if I meet with a student and, to just my capacity and my knowledge, again, I'm not a licensed therapist. I'm just a health educator, certified in, tobacco cessation. If I do notice that the student is in need of more mental health support, I do refer them out to CAPS, on our campus, as well as other mental health providers outside for maybe more long-term care. And I think that's important, again, when I'm talking with the student to have them recognize and just build that awareness that sometimes, when those stressors happen, that's why we have those little books and those quick kits of like, it's important to track that. And then you kind of start seeing patterns of like what's occurring. It's like it's during, midterms, or it's like when I'm with certain family members. So they'll begin to recognize, those connections there. And sometimes, they're utilizing not only tobacco but alcohol as like these coping mechanisms to other things that are happening in their lives. So again, it's really important, I think, when we're talking with these students to have them recognize like it's just not the tobacco or the smoking or vaping, whatever it is, but taking a look at them as a whole person and seeing what other factors are contributing to this substance that they're using.
Perfect. Jennifer?
Yeah, it's often a complicated relationship, and I think that's where we found, at least on our campus, it's helpful having somebody who's, um, like a licensed therapist, be able to feel able to kind of really explore that relationship. Sometimes it's very straightforward, and we're just doing nicotine cessation, but a lot of times it is tied up in other things they may be facing, and it can be pretty daunting trying to address that, especially if they're feeling you know, if they're feeling pretty depressed, and sometimes the motivation, even though there's this part of them that really wants to quit, it feels really, really difficult to tackle it in that moment. Or their anxiety is really high and they feel like they're relying on the nicotine in order to cope or to ease the anxiety. And so a lot of times we're doing psychoeducation about, actually what's happening. And even though it, feels like withdrawal symptoms can mimic anxiety. And so a lot of times when they're using nicotine, it's actually giving them that dose of nicotine, not actually, creating this true sense of calm. And the fact that nicotine can actually make some of these issues worse. So yeah, it can be difficult. I don't have a lot of I wish I had some hard data to point to, how often these things occur together, but often by the time they're coming our way, things are really not going great, and they're really looking for some support and making some changes. That it's been a hard habit to give up for a lot of reasons, and yet there's a part of them that's very concerned, or they're noticing some physical symptoms that really alarms them, and they're really ready to make that shift. So, a lot of it, again, it's that holistic approach, of trying to determine, do we need to connect you to maybe psychiatry, find you a long-term therapist? Do we want to offer that service in addition to the nicotine cessation support? So we're really trying to get them connected so that they feel better able to, to move toward their goals.
Amy?
Yeah, I can just kind of respond quickly. Although we don't have a lot of the targeted cessation services that my colleagues here offer, we do, because we are kind of a one-stop shop and we offer sort of this holistic approach, right? We have mental health housed within health services. We also have the nurses and the team who are identifying substance use and mental health concerns at the same time. So we're able to make a kind of a seamless referral when we know that there's a mental health concern that's sort of triggering the use. So all those conversations are happening at once, which just allows us to serve the student really sort of seamlessly within our center. But it's been a great tool to have sort of our mental health providers also be universally screening for substance use. So it's just these conversations are just happening in tandem. But I agree with everything that Jennifer and Natalie said in terms of what we're seeing. I don't have the data either in front of me, but yeah, those conversations just need to happen in tandem.
Sorry, we had one last question in the chat. Just look through it right in. Okay. What other resources do you feel are important to provide healthcare providers, administrative staff, etc., to implement more effective screening and referral policies? And anyone can jump on the question.
Can you repeat the beginning of that question?
Sorry. What other resources do you feel are important to provide healthcare providers, administrative staff to implement more effective screening and referral policies?
I can just jump in really quick. I think, our biggest challenge is just making sure, a few things, that the providers are aware, in recent, especially after COVID, we had a lot of turnover in our student health center. And so, and even still, it feels like we're getting a lot of new staff all the time. And there are so many resources to navigate on campus and even within student health. And so just really making sure that the nurses, everybody who's interfacing with students are aware that, we offer these nicotine cessation services. And also not only that, but how to refer, how best to actually connect students. Also just getting buy-in with the screening process. There's been a lot of discussion over the years of, do we have it, how do we do these health histories that students maybe fill out as part of a requirement when they check in for their appointment? Are providers following up on those? Are they asking the questions in the room? So just really making sure that everybody's on board with this is an important thing to be screening for in college students, and you know, actually just asking the question, because people are usually pretty honest if their health provider's asking. So.
Perfect. Amy?
Yeah, I think the buy-in is huge because we're screening now for so much. We're screening for housing insecurity, food insecurity. We're just looking at so much that the student is managing that, you know, you want to make the tool sort of effective. You want to use the right one, but also just integrated kind of well within what you're asking. So you're not spending a lot of time. It's hard. Yeah, hard to get buy-in when you're just sort of adding more and more, and you're sort of losing that time with the student to address what's going on. But so yeah, I think that's key. I had another thought that I forgot, so I'll let Natalie answer.
No, just to echo what has been said already, I think again that was kind of one of my challenges, like this information overload. Like there are so many resources for our students now. I think even more so post-COVID, because as administrative staff and leadership is recognizing kind of the needs of our students, basic needs, housing, food insecurity, mental health. I mean, it's just, it is a long list. And so I think, again, the more that our communities, students, peers, teammates, whomever it is, RAs, RDs know what resources are available, especially, you know, our medical staff, whomever it may be, I mean, is important. And again, just to get those students in the door any way possible is, you know, a small win at least. Yeah.
Can I add one quick thing is that when I remembered now, when you asked that question, the first thing I thought of was how important it is to make sure that you're asking the right questions and using the right terminology. I feel like we're always having to look at how we're asking, just what screening tool we're using. Are we still saying, do you smoke, and leaving it at that? Or are we using the right terminology that like Kim, you know, had shared earlier today? So all of that new information and following the trends and the emerging products is so important. So I don't know how many times many of us have been to our own doctors when the screening is just so outdated. So keeping that knowledge up is really important.
Perfect. Thank you to all of our three panelists. Just to echo what Kim said in the chat, we appreciate all of the attendees that came today. Thank you guys all so much for sharing the amazing work that you've done on your campuses. So inspiring and so beautiful to hear the differences between our CCs or UCs or private schools, and just to see what great work is being done to help our students in our college campuses. Thank you so much, Kim. I'll be passing it back to Symphony, but we really appreciate having you guys here and you guys sharing your insight today.
Thank you. It's been a pleasure.
Yeah, thank you. It was fun.
Just to echo what Andrea said, thank you to all of our panelists, and also thank you very much to Andrea for facilitating this discussion. I think it was really important information. We are a little bit over noon. We will be having a break from right now until 1 p.m. So I will go ahead and put on the screen. If you do want to leave and then come back, you can use the same Zoom link to log back on. But yeah, so thank you to everyone, and we'll see you at 1 p.m.